Hi, I'm Kimberly Stallo. I'm a certified wound ostomy and continence nurse and the clinical field specialist for Dermasciences. One of our exciting products is Medihoney. Medihoney is a medical grade honey that is very widely praised and embraced around the country and around the world. It has unique methods of action that are important in debridement and helping to jumpstart the chronic and stalled wound. Honey is a remedy that's been around for centuries. We've rediscovered honey in recent years and have actually discovered that leptospermum honey is very beneficial to wound healing. Medihoney has some unique properties. It has a very low pH and a very high osmotic process. It also has some very unique plant-derived properties that are very beneficial in wound healing. So we're often asked what exactly is a chronic wound. A chronic wound is, by definition, a wound that is not progressing at least 15% in 2 weeks, or a full or partial thickness wound that is not healing within 2 weeks. One of the things that are different about chronic wounds is that they are constantly developing necrotic tissue. This necrotic tissue requires debridement. Indications for debridement would be the presence of necrotic tissue such as eschar or slough, the presence of foreign bodies, and the presence of wound infection or biofilm. Eschar is tissue that is usually black, gray, or brown in color. It's very firm, dry, and leathery in texture. It indicates deep tissue injury, and it's very firmly adhered to the underlying tissue. Slough is tissue that is yellow and fibrinous. It also may be adherent or loosely adherent and stringy. Sometimes it is scattered throughout the wound, and other times it is densely adherent and covering the entire wound surface. It's important to remove necrotic tissue because it delays wound healing, it supports the bacterial growth, and it impairs the clinician's ability to adequately assess the wound depth. There are several methods for debridement: sharp debridement, autolytic debridement, mechanical debridement, enzymatic debridement, and biological debridement. Sharp debridement is not always an option for all patients. Likewise, there have been several regulatory changes in the enzymatic debridement market, which has changed the usage of enzymatic debriders. Medihoney helps to lift necrotic tissue, eschar and slough, from the wound bed. It does this through autolytic debridement. Autolytic debridement is moist wound healing that allows the body's own enzymes to soften the necrotic tissue. The tissue is then digested by the macrophage. Medihoney also has a very high osmotic effect, which is important in the debridement process. It has a very high sugar content. The lymph fluid contains plasminogen. The plasminogen converts to active plasmin when it comes in contact with the wound exudates. This plasmin then cleaves the fibrin and aids in wound debridement, which facilitates a very high fluid movement from deep within the wound bed. The lymph fluid is drawn to the surface, and this aids in cleansing and reducing the edema, but it also softens the necrotic tissue. Medihoney has a great ability to modulate the pH of the wound bed. Most chronic wounds have a pH that's quite high, around 9. Medihoney has a pH of 3.2 to 4.5. Since proteases do not thrive in a low pH environment, by reducing the pH of the wound bed, we can reduce the protease activity. Proteases produce slough, so a reduction in proteases can lead to a reduction in slough production, which helps to maintain a clean wound bed. One study showed that Medihoney was able to reduce the average pH of a wound bed from 7.72 to 7.26. Additionally, there are wound healing implications to the reduction of pH. Each 0.1% reduction in pH was associated with an 8.1 reduction in wound size. One randomized controlled trial compared the desloughing effect of Medihoney to that of a hydrogel. 108 patients had venous leg ulcers that were not progressing after 6 months, and also had more than 50% slough in the wound bed. At week 4, the Medihoney patients showed a mean reduction of 67% in slough, while the hydrogel patients only had a 53% reduction. By week 12, Medihoney had achieved an average 44% healing rate versus 33% in the hydrogel group. So let's look at some of the Medihoney cases. This first case is a patient with a suspected deep tissue injury and a stage 4 pressure ulcer. This patient was on Medihoney, and the Medihoney was changed 3 times weekly. After 3 weeks, the eschar was completely eradicated. At 4 months, despite multiple comorbidities, the patient remained infection-free and the wound was completely granulating. This next patient is a patient with rheumatoid arthritis who also had a history of esophageal CA and was undergoing therapy for his cancer. He had a wound on his foot that had a duration of 2.5 years without healing. He was started on Medihoney, and after week 4, the wound had decreased significantly in exudate, necrotic tissue, and slough, and the peri-wound erythema was decreased. At 4 months, he had complete healing despite his continual chemotherapy. This next patient is a 72-year-old diabetic female with an at-risk limb. After 1 month on Medihoney, the wound was significantly cleaner. They then placed the patient on negative pressure wound therapy and acoustic wound therapy for 1 month. At that point, the wound was clean and granulating and looking good, and they placed the patient back on Medihoney for the next 3 months, at which point she achieved total wound closure. This next patient is a patient with a 2-month-old small vessel vasculitis wound that was unresponsive to silver and hydrotherapy. After 1 week on Medihoney, the wounds rapidly improved, and after 2 months, the wounds were completely closed. This next patient is a patient with squamous cell cancer after radiation. The patient was then placed on Medihoney, and the Medihoney was changed 1 to 2 times daily due to high exudate of the wound. After 2.5 months, the wound was completely closed with minimal scar tissue. Medihoney is indicated for chronic installed wounds. That includes diabetic foot ulcers, leg ulcers, pressure ulcers, first and second degree partial thickness burns, donor sites, and traumatic and surgical wounds. Medihoney dressings provide gentle, rapid, continuous, and effective debridement. The dressings help to improve healing rates and jumpstart stalled wounds. Medihoney comes in a calcium alginate dressing, a honey colloid, and it comes as 100% honey in a tube. This variety allows it to be used on different wounds and different exudate levels. The treatment of chronic wounds is emerging as an important area in medical science. Dermasciences is a dedicated leader in this area, providing novel and technologically advanced products. Medihoney is our most widely known and utilized product. It's demonstrated clinically safe, effective, and easy to use with all other dressings and medications. For more information on Medihoney and our full line of advanced wound care products, please see the other videos in this series.